name is Nicole Kellogg. I'm 35 for a couple more months now, and I currently live in Santa Cruz in the city of Los Gatos, where the beautiful redwoods meet the sea. And I like it very much. It's no Maui, and where I've spent most of my adult life, but it is good here, and I'm glad to be in your class today. Celeste invited me back, tells me you're studying cancer, and I am a cancer survivor, so I do have a couple things to share with you. Like I said, I'm a cancer survivor. I was diagnosed with terminal stage 4 neuroblastoma when I was 9 months old, after my mother weaned me and a tumor made itself present in my neck as a lump sticking out of my neck. So she brought me in to the doctors immediately. They diagnosed me with neuroblastoma. Besides that tumor, I had one in my chest next to my lung that was the larger of the two tumors. So they began immediate treatment at Children's Hospital Los Angeles and Children's Hospital Orange County. Where they did a surgery on my neck to remove a tumor there, and did immediate radiation, chemo, and put me into a study where I still have the paperwork. It's typed up and it says that permission from my parents that the goal of the study is to prolong my life as much as possible, which they did, and to learn techniques to use on other children that have similar diagnosis. So my parents, of course, said yes, and to this day I'm very close to my pediatrician still. We're on Facebook, and he is retiring after 35 years, and I was one of his first patients, and a terminally ill one. So what saved my life, I guess, would be the research in that Children's Hospital went aggressive with their treatment of me and did not do the typical protocol for that diagnosis. They stepped it up and tried different things, which, as research goes, and now I'm still in research studies currently with St. Jude, and my same diagnosis now comes with a 40% chance at remission instead of a 2% chance, which was the best I was ever given. I went into remission when I was 4 years old, in my 4th year. So I really have been a lifelong patient. As an adult, because of the treatment to my neck and chest, the radiation, mostly radiation and surgeries. As an adult, I developed thyroid and parathyroid disease. I battle level 3 hypertension. So I take my blood pressure like 5 times a day at least. I'm on 3 different medications for it. I really have to be careful. I have a severe neuropathy from all the surgeries. So, from here, all this side of my face here, down my chest, my arm, my fingers, my eye, my ear, inside my ear, my jaw, in here. And under here, this is all numb. It hurts. And my chest and my breasts. It's really painful. And I also have a chronic post-traumatic stress disorder, PTSD, which is triggered, by different things, usually waiting rooms. Yeah, waiting rooms are a big thing. Dentist rooms. So there's a lot of anxiety that comes with being a repetitive patient. And you really have to be aware of your needs in order to overcome your struggles. I guess that's what's called strive. Strife? strive to overcome things like PTSD and attachment disorder, which also comes along with being a cancer baby. It's like being passed around from caregiver to caregiver. A lot of children will develop an attachment disorder who are in foster care or, have an unstable early developmental years. So, and I've also had my uterus removed. Yeah, a hysterectomy and an ovary that was full of endometriosis, and goodness, I had that done in 2012. So there's a lot of things. I think the hypertension is really bothersome. The attachment disorder really gets to me too. And, there's nothing you can do. I do the best I can, but, I'm a lifelong patient, like I said. Because as an adult, I've had 2 thyroidectomies, 2 cesareans, including a hysterectomy. I've had 2 dental implants. I had a tumor in my mouth, and an atypical mole removed from my back. I had a huge cyst in my groin I removed, and I had a lymph node removed from my neck, and 2 breast biopsies with fibroadenoma. So it just, and not to mention, I think I had like 7 to 12 blood transfusions. So we're talking hospital stays, ER visits, ambulance trips, inpatient, outpatient surgeries, urgent care visit, primary appointments, yearly labs, and specialist visits. I have yearly scheduled tests like ultrasounds, blood works, mammograms, x-rays. I also have communication with research studies. Currently, I'm with the long-term follow-up study, which is kind of the premier research study for the effects of childhood cancer, and they're really trying not to, the kids that are going to live through the cancer. The goal is the kids that are going to live through the cancer, let's not make them sick adults. Right? So, and then the kids that aren't going to live, like me, let's aggressively try to get them to live. And at the same time, if they do live, which is the goal, if they do live, let's not make their adult lives completely as